Hey guys, good morning, happy Friday. This is Dementia Doc, Dr. DenBoer. Again, I am not a licensed geriatric, I was a former geriatric neuropsychologist. I am not a licensed practitioner. This is not meant as any sort of medical advice. I want to talk a little bit about family roles and in caregiving, particularly non-paid caregiving, and how dementia, working with a loved one with dementia, can affect one's family roles. This is pretty, I would say, fairly obvious actually, but I think it's important to talk about. Is when a family member, generally our system is set up, and not in a great way, most healthcare systems, that they do not reimburse, almost all healthcare systems do not reimburse people, family members, for caregiving for their loved ones, primary or extended, that have dementia. Additionally, they do not pay, most employers or systems do not pay people for the job loss that they experience or the lack of work opportunity that they experience because of this. So that's another maybe real key facet of this. And the general goal, my work nowadays in the last, I guess, 7 or 8 years, has been to help change systems to reflect the reality of non-paid caregiving. So, in short, getting non-paid caregiving services to be covered by reimbursement funnels, which are healthcare systems, accountable care organizations, maybe even for-profit businesses. So that's my main objective in my career at this point, and have research support for that. So thinking about this topic, I think it's important to remember that to try the best you can. Ideally, you can have somebody else, you might be able to afford a paid caregiver situation. That's the most ideal situation. But less ideally, if you have to, which most of us do, and most of us want to do, serve as a caregiver for a loved one that is suffering from dementia, the main advice I might give is to try to set a very clear, if possible, and this is very, very hard to do, almost impossible, to set a very clear line between the caregiving services offered and your role as a wife or husband or partner or son or daughter or extended family member. To try to make sure that in your mind and in your behavior, you can set a very clear boundary for yourself and for the person that you're caring for. Very clear boundary regarding that role. So those roles, they inevitably will be blurred, but to try to set this clear boundary to make sure that those roles are not blurred going forward. Now, there's a lot of other things that one can do from a practical level, making sure you set time for yourself, making sure that there's going to set a very clear expectation among other family members of what you're going to do, what other family members are going to do for help, making sure you enlist other family members in this process. That's super, super vital in the whole process, making sure you're not going it alone. Most family members, there's one person that takes on the burden and they end up taking on more, and they kind of do more and more in this process, and that's not healthy for anybody, probably most especially the person that is being cared for. So again, not a ton of practical advice in this video, so I apologize, but I think the big practical advice I'm trying to give is set the boundary as clearly as possible as to what your role is. I would write it out. I would have other family members know what that role is and communicate that role. And if there's activities that are really, really difficult to do emotionally and physically, then my advice is to try to pool resources together and budget for a paid caregiver to do those resources. Some examples could be changing the individual. Some examples could be dealing with extreme problematic behaviors, etc. But also just giving yourself a break, a planned break. And And just know the backdrop of this makes it very difficult to do. Not impossible, but very difficult to do, because systemically we're not really set up, and we haven't really promoted this type of healthcare where we can reimburse family members for these services. And that's what I'm working on, and other people too. So have a great day. Take care of yourself. Remember, you can't take care of anybody else unless you take care of yourself first. Structure your activities. Hopefully these videos are helpful. Thank you for the likes, follows, shares. I really admire and am honored by the people that interact with this account and the work that you guys are doing, which is pretty amazing. Thank you guys so much, and have a great day. Bye-bye.